name is Melita Brown, and the next skill I'm going to be demonstrating is going to be I'm going to do a combination of adult and child choking because it's basically pretty much the same thing. So, with an adult and a child, if they're choking, everyone knows that the universal sign for choking is this. So if you see anybody doing this, then you know that they're needing help with choking. It's always good to ask for permission when you're rendering aid with somebody that is choking. So if you see them doing this, you'll ask them, I see that you're choking. Can I help you? Do I have permission to help you, touch you, to help you in your time of need? And they're going to say yes, of course. So with that being said, you will position yourself behind the victim. You'll do one hand with the thumb inside, and then you'll position your other hand on top of that fist. And you will just perform what is called abdominal thrust. So you'll just thrust upward, trying to get that object expelled. And while you're doing this, two things are going to happen. One, either that object is going to be expelled, which means it's going to come out, or two, the victim is going to become unresponsive. In that situation, if they become unresponsive, what you would do is you would just lower them down to the floor. You'll let them slide down your leg, and you'll lower them down to the floor. And once they're on the floor, you'll lay them flat on their back, and you will start CPR beginning with compressions. Both of these apply to the adult and child when performing choking first aid. Again, I'm going to demonstrate it again. The universal sign for choking is this. You're going to always ask for permission. Hey, I see that you need some help. You're in distress. Can I help you? Do I have permission to help you? And again, you're going to do what is called abdominal thrust. You'll say one hand, one fist, one thumb, a thumb inside, right above the navel line. And you'll position that other hand on top of that fist. And you're going to perform what is called abdominal thrust. And you'll continue doing this until the object is expelled, or if they become unresponsive, like I said, you'll just ease them down to the floor, let them slide down your leg, like so. And once they're on the floor, you'll lay them on your back, and you'll start CPR beginning with compressions. Now, if the victim is a female pregnant victim that is choking, you would do her a little different. You would perform the abdominal thrust more above in like the chest area versus the abdomen, because you don't want to hurt the baby. So you'll do hers more up in the chest versus here in the abdomen. Okay? And same thing applies to her. You will continue doing those thrusts until the object is expelled, or if she becomes unresponsive. If she becomes unresponsive, the same thing applies to the pregnant female victim. You're going to slide her down your leg, and once she's flat on the floor, you're going to lay her on her back, and you're going to begin CPR, beginning with compressions. Okay. All right. Well, that concludes my skills training on adult child choking, along with the pregnant female choking. Thank you.